Welcome to Dental XP. I'm delighted to have a real star in periodontal surgery with me today, Dr. Cobi Landsberg from Israel, who has been a member and a contributor to the periodontal literature very much in the early 90s when implants and extraction site therapy was becoming very, very much a hot topic. Cobi lent much of his clinical research to that area, and I'm very proud that we were able to get him to speak with Dental XP today. Cobi, thank you for being with us.
Thank you very much for having me this morning. I'm delighted too to meet you again, and I'm ready to present my material to you.
What's exciting these days? You've always been, I have to tell you, you are always on the cutting edge with a lot of the material. You work with some very, very fine dentists. I know you did a lot of work with Nitzan Bichacho, many other also contributed to this site. What is new, what is exciting in your dental practice these days?
Well, for many years I was going the conservative way, which is a way that I thought would be best for me, because at that time, for my patients actually, because at that time I thought that I'm not ready enough to provide my patients with the procedures that I am able to do now. So I have taken, during these courses, I've been watching you, I've been watching other people too, and in order to try and become a better professional for my patients. I do believe that if you are not able enough to provide things that you know that other people are able to provide to your patients, I do believe that you have to share patients with them. But this is my nature. I'm trying to become better and better. So these days I do block grafts, and I do advanced regeneration procedures, taking care of the soft tissues, and trying, you know, as much as possible to really ask myself what I can do to the patient, not what the patient can do to me. So
what is new when you talk about regenerative procedures? It's always exciting, and really, in a lot of ways, the development of socket seal procedures in your article in the 90s lent itself to a lot of different people that expanded on it or attempted to change it, and it's still very, very controversial issue. Do we place the implant? Do we not place the implant? Today, also, what do we put in the socket? Do we need to do also tissue at the same time as bone? Do we get crest-to-crest healing? Dr. Nevin's work that discussed BioOS and how much percentage do we get after several months of grafting. Some of the things that I like to always ask you, because you really have been a trendsetter, is are you utilizing any different materials? Are you looking at bioactive modifiers, blood-borne growth factors like PRGF or PRP? And are you seeing that your protocols have changed in the last decade?
Well, it's interesting that I've started using socket seal surgery really in the early 90s, and for some time I thought that it might work for me. Maybe it's a technique which is too sensitive, and perhaps there are other better techniques, and I've realized that more and more people are really using this procedure and even publishing about it. And within the years, perhaps there's one major thing that I've started using is that I stopped using, not completely, in cases that are committed to prosthetics, I stopped using the sutures at all, and I'm just using the pontic, the base of the pontic, to hold the tissue down, and it works nicely. And then, yes, I'm looking forward, you know, for more advanced materials to place in the socket itself. Nowadays, the most popular bone grafting material that I'm using is BIOS.
Is it BIOS cancellous or the Gem 21?
No, the Gem 21 is not available to us as yet in Israel. So I'm looking forward to try to use this material too. But
so you were saying that it's what you're using the sockets. It's not as much what you gain, but maybe what you don't lose.
Yeah, when I see the patient and he presenting to the office with a tooth that has a lost prognosis, a poor prognosis, I don't think, you know, the first question that I'm asking myself is not which implant to place to replace the tooth, but what is actually the procedure that I master that works best for me in order to make it such that I will not have recession, because in many of our cases we have to be worried about what's going to happen to the papilla and what's going to be happening to the marginal gingiva. So for me, socket seal surgery is a conservative way by which I can keep the papillae, keep the ridge nicely, and if not, then I can, how do you say, to make it better?
You can improve.
I can, and if not, I can improve the outcome by using another mode of therapy, like guided bone regeneration or soft tissue augmentation. I feel that in many of our cases that you're using immediate implant placement and loading, we have recession. We get recession, and it's like a one-way ticket. You can't go back once you've implanted the implant.
I want to stop there because what he just said is so important to those of you that are watching right now, is that you have to be very selective with cases if you do immediate implant placement. My tendency is it has to be thick, flat tissue type. It has to be an area that if you're going to start out doing this concept, maybe in the posterior region, bicuspid area, in the anterior region. If it's a mild or moderate or thin tissue type, I agree with Cobi. I think that it's a very risky technique to do immediate placement. I prefer to use the socket seal procedure. I like to use today a mixture of mineralized particulate bone, autogenous possibly with a bone scraper or with a piezo, with a very easy to harvest, and I mix it with BIOS or BIOS Gem 21 today. I think it's a good mix because the BIOS keeps it from resorbing, and the autogenous or mineralized allograftic products allow for some of the ingrowth of the bone into that area, and I always seal it with soft tissue, which I really learned from you. There's a very big push today, and what's nice about doing it this way, by the way, is that you preserve as much of the site as you can. We know that from the Nevins work. But also, it allows you not only prevent recession, but to come back later to place your implant with thicker tissue. And if you do have some loss of that ridge, and you sometimes will, whenever you take out a tooth, the ability then to evaluate it as a second surgery at the time of placement of the implant, possibly doing additional grafting. If you do the implant right away, you're really now working backwards, and it's very difficult to make up that error and any of the further damage we have to the site. So I happen to agree with you, and I think it's very important when you're listening to this is not just somebody who's been doing this a few years. I mean, this is a person who expanded on concepts that were done with Pontics in the late 70s and 80s and really started this concept for the implant and regenerative dental market. In a lot of ways, when I was looking at orthodontic extrusion, it's not something that my brother and I developed. It was developed in the 40s and 60s and 70s, but yet we developed it for the regenerative and implant areas of dentistry. I think Cobi did the same thing with his socket seal procedures. And then we're very much looking forward to your presentation, not only in extraction site management, but on regeneration. And maybe you can touch upon some of the things that, if you could, the utilization of allograftic tissue, whether it be things like dermal grafts or pericardium, and whether or not you're utilizing any type of growth factors or blood-borne growth factors in your regenerative procedures. We're looking forward to it. I'd like to say this has been an incredible week. All the very, very high level of talent that we have with us, and Cobi coming from Israel to be with us, we really thank you. You're about to see part 1 of a presentation. We're hoping we can get part 2 and part 3 when I'm with Cobi in Israel in a few months. And
glad to.
And we really look forward to it.
Yeah.
We're glad to have him as an expert on our panel on Dental XP, and I think you're going to be very, very interested to see his lecture. We'll see you soon again on Dental XP.